Greetings again, Scott here, known as Cantaloupe to some online, and I am outdoors today. It's a beautiful day in December and between rain showers, actually, and I'm going to bring you a topic about a very important one, and it's popular right now in the news and social media, and I'm almost 100% sure you care about it, and that is healthcare and how that's supposed to work in a nutshell. And my take, for what it's worth, in less than 10 minutes. So, healthcare is kind of an interesting subject because, we've addressed many of our problems with healthcare via insurance, of course. Pretty much everybody knows about health insurance, and there's a lot of recent news about that. And I'm not going to talk too much about that, but the idea with insurance is just to touch very briefly on the idea. It's supposed to be a little bit of a gamble on both sides, but it has become less of a gamble, if not zero gamble for companies, because whenever, for example, insurance is required, like vehicular insurance, and like they tried to do actually with health insurance, but I think that they repealed that. There's no incentive for the company to pay out ever, like literally none, when it's required. So they can just count on income, they can count on business because you have no choice. And that same spirit, whether it's actually legally required or not, is predominant in our world right now. So anyway, insurance is a deeply troubled industry, but that's not really the focus of this video. This video is about specifically how our insurance design, our model of health insurance is fundamentally broken in the context of our economy, our economic expectations of a so-called free market, of, if you want to call it capitalism. Again, it's a big subject, but when people are forced to work for a living, hear me out, whether they are consumers of health insurance or employees within that complex, every one of them have bills to pay. So health insurance gets expensive real fast because medical technology gets expensive real fast, legitimately. So there's this question or idea going around that people are being denied the right to live by health insurance companies. And there's something to that. Okay, I'm gonna first acknowledge the complaint. Getting denied or refused coverage for a pre-existing problem, etc. The well-known reasons they give for shooting you down, even when it's a life-threatening problem. You're gonna arrive at that point. We all do. In theory, you could stay alive forever if you could afford it. It's not realistic, is it? Our planet isn't robust enough to do that, even for a single person, as far as I know, at this time. So with that in mind, there's a limit. There's a reasonable limit to how much expensive coverage you can expect to get ever. Like, just because you can buy something doesn't mean it's available. So there's a supply and demand question. But more importantly, and this is the final, ultimate point that I'm trying to make in this video, when your health insurance employees, when your healthcare workers have to, have a house, a reasonable thing, right? When they have to have electricity and their own everything, you can't expect to pay nothing. You can't expect to even have affordable health insurance, because they are equal victims. And this is something, nobody wants to hear this. They don't want to hear that the rich people are victims, but they're just winning this game that is designed to pit you against them. This is an important observation. Bankers are not greedy. They're just winning the messed up game. But there's a different kind of game. We don't talk about it too much, but there's an absolutely different kind of game where essential businesses are subsidized, basic human needs are also subsidized, and then people can get down to business that they're supposed to do without fear of dying when they don't. That is, people, healthcare workers, the healthcare industry itself can expect support, ongoing financial subsidies to function without having to ramp up your bill and literally kill you off. Okay, so before you start shooting down healthcare CEOs or the industry as a whole, understand that those people are stuck in the same trap as you. Okay, start with that idea. Okay, the opportunity, the fix, the solution is to correct our economic model, and it fixes everything. It's a starting point. It's a starting point to get back on the right track. It doesn't literally fix everything, but when you fix the core problems, the peripheral problems start to disappear. Anyway, reach out to me if you have comments, whitehotrobot@gmail.com. Thank you for your time.